Today we'll try and understand a little bit about peritoneal cancers. These are fairly rare cancers. Most people don't know much about this, but sometimes these cancers usually end up with, in very advanced stages, and treatment options may be quite limited. So let's understand a little bit about peritoneal cancers. What is peritoneum? Peritoneum is basically the inner lining of the abdomen. So all of us have a complete inner lining of the abdomen which separates the abdominal wall from all the organs inside. And that very, very thin layer is called the peritoneum. It's just 1 micromillimeters thick. But this peritoneum is one of the ways by which certain cancers can spread very rapidly inside the abdomen. When we find peritoneal disease or peritoneal cancer, a lot of these cancers are actually secondary peritoneal cancers, meaning that tumors from the stomach, from the pancreas, from the liver, from the ovaries sometimes can spill over or spread into the peritoneum and present in the form of small whitish nodules that are spread all over, right from the diaphragm, which actually separates the thorax from the abdomen, right down up to the pelvis. And these small nodules then encourage more and more fluid to be secreted, and that forms what is known as ascites or fluid in the abdomen. And this usually, when it's a secondary peritoneal cancer, this is usually a fairly advanced stage of the cancer, and many of these patients would then classify as a stage 4 cancer.